We all know that the sperm play a very important role in the IVF process. After all, the sperm is a gamete just like the egg is, and you need a sperm to fertilize an egg. The reality is a little more nuanced and a little more complex, simply because while it's true that the sperm does carry 50% of the genetic component of the baby, it's also equally true that the egg has a much more important role to play, simply because the egg is so much larger and contains all the cytoplasm and contains all the mitochondria. So that sperm quality is important, but to a limited extent, and let me explain why. In a regular IVF cycle, you add the sperms to the egg and you allow the sperms to fertilize the egg in the test tube. And because we're doing it in an IVF dish, the number of sperms which are required are really few, which is why fertilization rates, provided the sperms are functionally competent, are good, provided again that the laboratory is good. These are two important conditions. Now, a good IVF lab obviously will be one which makes lots of embryos and provides photographs to patients because they're transparent. Sperm quality is a different matter altogether, because even though the sperm count is fine and the motility is fine and the semen analysis looks okay, you really cannot judge sperm functional competence. Because the question is not what is the sperm count and the motility. It's not like a bank account. The question is, are the sperms capable of fertilizing the egg? And the only way of answering that question is by actually doing an IVF cycle. And that's an expensive way of answering the question, because sometimes these men will have great sperm counts and motilities, but they will have total fertilization failure after IVF. And then the doctor will say, well, it was a sperm quality problem, and the next time we will need to change the treatment protocol. The good news is that if you have total failure of fertilization after IVF because of poor sperm quality, we can treat that by doing ICSI or ICSI or intracytoplasmic sperm injection in the next treatment cycle. Because when we're doing ICSI, we do the fertilization. We actually inject the sperm and we put it inside the egg itself. So the sperm has to do much less work. Think of it like we're giving a piggyback ride to the sperm inside the egg. And then the fertilization rates practically are 100%, provided, of course, you have a good laboratory and a good embryologist. And this is why it's so important that you understand the role of the sperms in fertilizing the egg, and equally importantly, the role of the IVF laboratory. And that's why you need to find a good clinic which will share information with you. So let's say, for example, the doctor tells you we did IVF and the sperms didn't fertilize the egg. You must insist on photographs of those unfertilized eggs. Did the sperm bind to the zona? Were the sperm added properly? What happened to those eggs? Were they mature eggs or not? So, for example, did they fail to fertilize because there was infection in the culture medium, as a result of which the eggs died, and not because of a functional competence problem with the sperm? These are important questions. And this is why you need to find a lab which will share this information with you. The tragedy is that a lot of labs are incompetent, they will hide information from the patient. That the reason for the failed fertilization was not poor sperm quality, but because of a poor lab. And because of the infection, all the eggs died, or all the sperms died, or all the embryos died, but they will not tell the truth to the patient because they want to hide it from the patient. And that's why you need to be proactive and you need to ask. The good news is that if you find a good IVF laboratory which is good quality, all these problems will automatically get solved. But you need to do your homework for yourself. I hope this was helpful, and as an IVF doctor, I take pride in sharing my knowledge with IVF patients to help you get the best possible medical care. If you have any questions, please feel free to email us and we'll be happy to create a video to answer your questions.